Welcome, doctor. What are the causes of green stool? And is it something dangerous or something normal? And what should we do if we find that the stool has changed to green? Let's start together like this. First, let's talk about the reasons. And also, as we discuss each reason, let's talk about what we should do. And is this something concerning or something normal? Let's start first with the very common thing. Children who are bottle fed, some of these children have stool that initially changes color to green. And this is normal as long as there are no inflammatory symptoms accompanying the change in stool color in infants. In breastfeeding infants, it is not indicative of any disease, and we don't need to do anything about it. In some children, right after birth, the black stool that comes out initially sometimes turns green and stays that way for several days at first. And this is also normal and does not warrant any concern. Then there are children who start eating. We are taking the topic step by step from when we were young. The children who are breastfeeding, and we have started to wean them in a simple way. We give some foods, along with breastfeeding to some of the children, to whom we start introducing new foods. The color of the stool might turn green, and it's not concerning as long as there are no accompanying inflammatory symptoms. What are these inflammatory symptoms, doctor? The symptoms that indicate there is inflammation in the colon or stomach now, such as vomiting, diarrhea, or colic, or a fever, or a sudden drastic change in the child's general condition, like becoming very lethargic, suddenly losing appetite completely, and so on. These are the symptoms we mean. So as long as the changes occurring at this age, with the introduction of any new food or with formula feeding, are not accompanied by inflammatory symptoms, it's not concerning and doesn't require any action. As they grow a bit older, we look at children of school age. These children start buying things from the supermarket or the school canteen that contain artificial colors like ice cream, for example. Back in our days, there was something called Lolita. I don't know if it still exists now or not. Nowadays, in ice cream, surely some children buy ice cream that has artificial colors. These artificial colors change the color of stool and also urine, and there's no need for any action as long as there are no accompanying inflammatory symptoms. Alright, as we move on to older ages, let's address the general public. Some people, whether children or adults, experience gastrointestinal infections. These gastrointestinal infections are often accompanied by diarrhea, and sometimes the stool appears green. Now, why is that? Because the colon is emptying its contents quickly. The bile, which is supposed to come out with the stool and give it a slightly brown color, is supposed to break down when the food stays in the colon for its usual duration. This bile doesn't break down and comes out with the stool because it exits quickly without staying in the colon, resulting in green-colored stool. This yellowish substance, folks, comes from the liver and gallbladder. We call it yellow, but its color is not a pure yellow. Its color ranges from yellow and green to brown. It makes the urine take on a yellow color because part of it is excreted through urine, and it makes the stool take on a brown color because part of it is excreted with the stool. When it passes quickly, without breaking down, the stool can turn green. So, gastrointestinal infections that come with diarrhea can cause this. Well, we don't ignore this. We don't treat the green color of the stool. We treat the gastrointestinal infection, and when we treat the gastrointestinal infection, the stool returns to its normal color. So, who else might have this? This is a large segment of people who don't have gastrointestinal infections, people with irritable bowel syndrome, IBS. In some people, IBS is accompanied by diarrhea. Some people have constipation. Some people have a mix of both, and a large percentage of people with irritable bowel syndrome, as soon as they eat, they immediately go to the bathroom to pass stool. And this stool is not outright diarrhea, but this stool is soft, and we call it loose, meaning it's somewhere in between. Sometimes this stool is green in color because the time that the food was supposed to spend inside the colon was shortened and it passed quickly. As a result, the bile wasn't broken down properly, which left the stool green. Who else, doctor? People who eat a lot of green leafy vegetables. For example, spinach. When the amount of green leafy vegetables increases, it naturally contains a pigment that makes it green. This pigment passes with the stool and also makes it green. This is not a cause for concern because we don't have inflammatory symptoms. Anyone who is worried about this color issue, when they come to the clinic, we review with them whether they have eaten leafy greens or not. Have they consumed anything with artificial colors or not? How is your colon doing? Because if they have irritable bowel syndrome, it indicates that there might not be a pathological issue or anything. Well, there are some medications, folks, that when we take them, they change the color of the stool. Most of these medications are antibiotics, for example, streptoquine. Many people use streptoquine on their own for diarrhea, but we do not recommend this. We had previously agreed that anyone with diarrhea should not take antibiotics without consulting their doctor. However, many people take streptoquine with diarrhea, which changes the color of the stool to green. So, this is one of the medications. What else, doctor? A type of intestinal antiseptic called nanazoxide, nitazode, or flagyl. These 2 or 3 medications sometimes change the color of the stool to green after we use them, and they also change the color of the urine and the taste in the mouth. These 3 medications are notable for causing this change in urine color. Stool, taste in the mouth. So is this something to worry about or not? If the doctor has prescribed the medication and it changes the color of your stool, this is not something to worry about at all. Intestinal antiseptics actually play a role in treating the cause of diarrhea or gastroenteritis. But you shouldn't take them on your own because sometimes we don't prescribe antiseptics or antibiotics at all. So we have agreed that all the reasons we mentioned are not concerning as long as there are no accompanying inflammatory symptoms. If there are inflammatory symptoms, then this situation requires you to contact your doctor or visit your doctor so they can assess you and tell you whether it's something normal or if we need to conduct tests or take specific medications. However, for all the people who do not have inflammatory symptoms, when the color changes to green and they have done something or have one of the conditions we mentioned, this situation becomes non-concerning. This was the response to everything related to green stool color. I hope you liked this video. Please subscribe to our channel, and it would be great if you could like this video. And God willing, we will prepare a video for you soon about unusual urine colors so that we cover the unusual colors of urine and stool that we need to pay attention to. See you soon.